I'm Chris Donegan, and here's our subject, Colin.
Hi, I'm Mohammed Solomon, and the 3 tests we're going to be doing is the 6-minute walk test, the 8-foot up and go, and the chair sit.
This is Christopher Donegan again. Today we're going to be doing the chair sit to stand test. This test involves a straight back chair against the wall, a total of 17 inches high, with no armrest, and a stopwatch because we're going to be taking count of the amount of repetitions in 30 seconds. This may be useful in quantifying functional change of transitional movements, and it also measures functional lower limb muscular strength. This is my subject here, Colin. And today we're doing the chair sit to stand test. The equipment involved today is chair, typically 17 inches in height, flat up against the wall, and a stopwatch. We're timing this for 30 seconds and counting the amount of repetitions. Alright, I'm going to show you, Colin, how to do the chair sit to stand test. So what you should do is sit in the middle of the chair with your feet shoulder width apart and your hands crossed against your chest, palms on your shoulders, and what you do is stand up like so, and you sit down, and you're counting how many, we'll count how many repetitions you do for 30 seconds. Okay, so now we're going to have Colin perform the test. You can start. Is timer ready?
Yep.
Okay, let's start now.
More seconds. Alright, 30 seconds.
Alright, so you performed 13 repetitions.
Good evening, my name is Mohammed Solomon, and the test that I performed on Colin was a timed up and go test. It's a simple test used to assess a person's mobility and requires both static and dynamic balance. It uses a time that a person takes to rise from a chair, to walk around 8 feet or 3 meters, turn around, walk back to the chair, and sit right back down. This is a very important test for individuals of older age to make sure their mobility is at a place where they can perform day-to-day activities without risk of injury, falling, or something of that nature. Our subject, Colin, performed the test extremely well. He was in a normal range, I believe, and this test can be used in our field in many ways for testing individuals who are of older nature, again, to make sure they're able to conduct day-to-day activities without being injured. Thank you again. My name is Mohammed Solomon.
My name is Mohammed Solomon, and this is Colin. The test we are doing today is going to be the 8-foot up and go test. The point of the test is to sit down, hands on your knees, then to get up at the go sign, walk as quickly as possible around the cone, and come back down to sit. We're going to do the test 3 times, 1 practice trial and 2 test trials. We're going to average the best out of the 3 trials. Now I will demonstrate this test. You sit down with 1 foot slightly in front of the other, hands on your knees, on the go sign. You stand up, walk quickly around, but not running, and you sit back down. Let me get out of your way. When I say go, you're going to get up, walk around quickly but safely on the cone, and come back down. Ready, set, go. Alright, stop.
5 seconds.
Not bad. We're going to start the second trial if you're ready. Ready, set, go. Thank you so much.
4.88.
Even better.
Christopher Donegan, and today we're going to be doing the 6-minute walk test, which is a variation of the 12-minute walk test. The 6-minute walk test is for people with heart or lung disease unable to walk for full 12 minutes. It's as well a submaximal functional capacity test. Most activities done day to day are at submaximal levels, so this gives us data reflecting their overall submaximal functional capacity. The strongest indicator for 6-minute walk test is measuring the response to medical interventions with patients with heart or lung diseases, as well as an overall view
of morbidity and mortality rates of each client. Absolute contradictions for 6-minute walk tests include unstable angina under the previous month and myocardial infarction under the previous month. Relative contradictions for 6-minute walk test are resting heart rate of greater than 120, a systolic blood pressure more than 180, and diastolic blood pressure more than 100. Patients with any contradictions should consult a physician, and just to see if for this test the physician should be present. Safety is a main concern, so every step should be taken possible to make sure the patient is safe.
Chris, and I'm here with Colin, and before he does the 6-minute walk test, we're gonna get readings for his pre-heart rate. I'm gonna get a pulse. And starting. Okay, so that was 30 seconds, and I counted 38 beats. So his resting heart rate is 76. Okay, now we're gonna collect data for blood pressure. Pull up your sleeve. Thank you. So what I got is 130/80. Hi, Chris again, and I'm here with Colin, and now we're going to do the 6-minute walk test, and I'll demonstrate for you how to do this test. You just walk into the cone at the end, and you come back. I have labeled every 25-foot interval with the cones, and it's 100 feet in total. I'll demonstrate for you what to do. So you're just gonna walk as fast as you can for 6 minutes, and there's a chair there at the 50-foot interval, just in case you need to take a breath. Turn around, go back to the starting point, and do that as many times as you can. And every 2 minutes, I'll give you a heads up so you know where you're at. That's for a total of 6 minutes. Okay, Colin, now we're gonna start the 6-minute walk test. If you feel tired or anything, let me know. And safety is the biggest concern, so let me know if any distress happens. All right, we can get started. Good job. Keep going. It's 1 minute.
If you want to stop the video now, just pick up.
Yeah.
Oh, I see what you're saying. Okay.
This is 400 feet. This lets you excuse all things. I wouldn't be able to do this.
Yeah.
Probably crammed and full halfway. Oh yeah, thank you for your time. Like the whole wrap up. But we can get inside or wherever you want to go. How you holding up? Okay. How much time is left? 3 minutes.
Good job.
3 minutes left. Two more minutes.
Good job. 2 more minutes. Good job. Last lap. Come on.